Living with an incurable disease can be managed effectively over a long period if individuals take proactive steps such as undergoing testing to determine appropriate medications and management strategies. Nigerian researchers highlight the importance of testing, particularly for diseases like HIV, which are prevalent among young people and can significantly impact longevity. Victoria Tokolo reports on HIV self-testing after speaking with medical researchers. Her report is here presented.
Medical researchers warn that youth aged 14 to 24 in Nigeria are at increased risk of new HIV infections, but lack access to necessary prevention services. Essential services like pre-exposure prophylaxis HIV self-testing, STI testing, and youth-friendly clinical services are not widely available across the country. In response, the Nigeria Institute of Medical Research has developed strategies to improve the uptake of essential HIV prevention services among young people. Professor Babatunde Salako, Director General of NIMR, discussed these efforts in an interview with Trust Television, detailing the measures taken by medical researchers to combat the spread of HIV.
We are also certified by WHO for what we call pre-qualification for kit testing. So if you bring a new kit or a new diagnostic device to Nigeria today and you want WHO to recognize it, it is NIMR lab that will do that test and provide that report for the WHO before that kit is registered by the WHO.
Medical researchers report an increase in HIV self-testing among young people in Nigeria. However, they emphasize the need for better and sustainable solutions, as some individuals have expressed concerns about this self-testing method.
So HIV self-testing is all about people becoming aware. You can go to a pharmacy, the way people pick pregnancy test, the way people pick a urine test, you pick it, buy it yourself, and go to your home, comfort of home, and do the test. So that one HIV self-testing, so that issue of stigma is no longer there.
We found that if you actually call young people and tell them to design a program, right, where you roll out HIV self-testing, will they come? Would young people even care to know their status? When we started, maybe about 20% of youth, hadn't even heard about it, have even tested with HIV self-testing. After we continued across 5 years, you can see that our numbers went up to 90%, which means young people care about their health if you only but give them opportunities.
In discussions about HIV self-testing, many citizens advise young Nigerians to embrace this method to know their HIV status and maintain open communications with doctors.
It's a good idea, but people going out there and do the test by themselves. Because the stigma in one having that HIV is a very big problem, mentally and otherwise. So it's a good idea if one can go and do that test by himself and have it confidentially with his medical doctor, then it will be a big safe for you.
If I'm able to test myself and discover my HIV status, it's possible for me, it's okay for me to go to my doctor and explain to him this is what I discovered about my HIV status. And go to answer me and give me the appropriate drugs. But if I'm hiding I cannot expose myself, you will not be treated and you will not be okay, and it will be dangerous to your life.
Medical researchers emphasize that there is currently no effective vaccine for HIV. While research is ongoing, it will take many years before an HIV vaccine becomes available. They encourage everyone to get tested and know their HIV status, stressing that an HIV diagnosis is not a death sentence.